Welcome to Smokin Bulls, a podcast about business, money, and lifestyle. Today we're going to be talking to Dr. Mikolaj Raszek about genome sequencing and what we can learn from unwrapping our DNA. I'm Tyler.
I'm Dave.
Let's get into it.
If you have a predisposition to cancer, you can kind of drill down the type of cancer with a DNA test?
Yes, you can, but not always. And the reason why is because thanks to sequencing, and by the way, DNA sequencing has absolutely revolutionized cancer medicine, cancer-related medicine, or treatment of cancer. It just changed that world completely in the last decade. And one thing that was discovered that cancer is driven by specific mutations, and these mutations, you can find similar genes affected in many different types of cancer. Sometimes specific gene is only seen in one type of cancer, but sometimes genes are seen throughout a variety of different cancers. So yes, you can discover specific cancers predisposition if you screen yourself, but not necessarily always. And does that answer that question appropriately?
No, it does. I think that's what I was kind of leaning on, is how you can determine that. That was a great answer for that. And just tying one more question to this was, once again, around a previous discussion we had. I think you said that there was a way to, if someone had cancer already, diagnosed with cancer, they had a biopsy, you could have the biopsy DNA'd, and then they could perhaps match up because the DNA of a cancer biopsy is going to be different than the body, I think is what you said, because that's the mutation. Then you take that mutation and try and match it up to other scenarios from people in the world and how the treatment might have been applied to that specific mutation. So you can find data throughout the world on the
effectiveness of the treatment.
The effectiveness of the treatment based on that type of mutation. So you can really go to the spot where somebody else might have had that exact kind of mutation and find out what was the most effective means to helping that individual. So that's a different type of DNA test, is it not?
Yes, and I can't believe you remember all of this with such a high accuracy when we probably talked about this more than a year ago.
I do listen sometimes.
You must just be good at presenting it or something, Mikolaj. That's what it is.
Like, wow. But you got it correct. So cancer is your genome that has been mutated. So it's almost like a different person at that point. So what you need to do is you look at the cancer genome, and by looking at what specifically was mutated in your cancer tissue, you can actually align those mutations with specific treatments. And these are called targeted therapies. So this is slightly different from your standard approaches, which would use chemotherapy, which is very broad attack on fast dividing cells, which is why sometimes when you treat cancer, you will see side effects such as hair loss, because your hair follicles are some of those fast dividing cells, and those are what we're attacking with chemotherapies. These are targeted therapies because the treatment, the medication, takes advantage of what specific mutation is present, what gene was affected, and therefore what specific biological pathway was affected. We can take advantage of that and go and target those cancer cells specifically. So that indeed does exist. Typically in medicine right now, this approach is used as a last resort, typically, not everywhere. There's centers that around the world that will sequence cancer tissue right away and take all of that information into account as to how a patient should be treated. But it's very expensive, which is why it's still not adopted worldwide everywhere, while many clinical trials have already been have taken place showing how these targeted therapies work. Well, they're all approved medications. We're talking about well over 100 different targeted therapies that have been already approved for use by FDA in the United States by taking advantage of cancer sequence. But expensive process, and the reason why it's expensive Because when we're talking about you decoding your full genome you're born with, that genome that you're born with, that you inherited from your mom and dad, well, that same genome is present in every single cell of your body. Of course, it will mutate to some degree. Different cells in your body will mutate because, for example, UV exposure and so on. And as you accumulate these mutations, that's how you can eventually increase the risk of cancer development. And that's how you indeed develop cancer. And hence, if you're born with predisposition to cancer, you just speed up that process naturally because you already have certain limitation that you're born with that increases the likelihood of you developing cancer. But you have the same genome, same DNA in all of your cells. Now, when you have a cancer, and that's now think of like a different person and its own individual genome, you need to be able to extract that tissue from the sea of your normal, healthy, or normal genomes. And therefore, you need to increase the magnifying power to be able to accurately identify those cancer-specific mutations in comparison to the mutations you're actually born with. And in order to increase that magnification power, you just need to enhance the technology, if you will, if I can phrase it like that, and that just costs more money. So if you only have to invest a few $1,000s to decode your genome, including the clinical interpretation, then you need to multiply that several fold in order to do the same thing for your cancer tissue. And a very high quality investigation centers for that, they will do both in order to know precisely which mutations you were born with versus which mutations are found in cancer. And sometimes that's important because if you have a cancer predisposition, that can actually select targeted treatment for your cancer as well. So to give you an example, BRCA gene is a very famous gene that's a driver of breast and ovarian cancer development. It's one of the most common mutations discovered, including in a presumed healthy people when we discover pathogenic mutations. Now, that's the same gene that Angelina Jolie discovered her predisposition to cancer and why she took the proactive measure of double mastectomy to protect herself from the future development of cancer. But if she did develop cancer, the fact that she had a mutation in that specific gene, that could have also been taken advantage of to select a specific treatment.
Yeah. That's the kind of thing that most people really don't know about. Most doctors
Correct.
I'm not sure they talk about it to their patients as an option. I mean, I guess we're so used to in Canada the system, and you go with what the system is, and most people don't want to pay or be out of pocket for any extra money, and I get that, but I think there's a lot of people who would take that opportunity maybe to do some DNA work just to get a handle on their situation for sure. I know Tyler's got another question. I think we could probably talk this one quite long just on this one specific piece here. So, yeah.
And especially since neurogenomics probably provides access to arguably one of the best cancer predisposition tests available in the world. It's so advanced. And in fact, we're the only ones who offer a test that would actually assess you both from the DNA as well as RNA sequence to see how your predisposition to cancer might look like. No one else offers that test in Canada because this is a new test. And also if you discover a mutation in one family member, that same company will then test your entire family for that same mutation for free within a specific timeline, but entire family. Extremely powerful. And the reason why they do that and they offer that service is precisely to protect the individuals. Because if you discover one, obviously we all related in a family to a degree, 50%, 25%, and so on. You always have it, your degree of relations. And therefore, many family members could also have the same mutation. So you can see the benefit of such screening, advanced screening. Very, very powerful technology. Very proud of actually being able to offer this test to Canadians.
Thanks for tuning in to us at Smokin Bulls, the podcast about business, money, and lifestyle. We had a great conversation with Dr. Mikolaj Raszek today. You can find out more information about us at smokingbulls.com or follow us on our social media.